When I come and close your hospital that is worth millions of money, how do you feel? Enforcement in this country is a risky job, and nobody who loves enforcers, I can tell you the truth. Even the police know that they are very bad, but people fight them because they are only looking for the bad part. Even for you, when they pop in and start throwing your cameras here, you'll always get to. So for us, we are only empowered by trying to support the public and protecting them. There is a lot that we do that is not seen to support the public health. Remember, arresting a quack, and I want to tell you the truth, is not easy. Because when I move from the office here and they find our vehicles, they have a network of WhatsApp, they have a network of mobile talking and all this side of things. I may learn to one quack, the rest they communicate to Amefika Kaptembo. This is officials from Farmers and Pharmacies Board, and on behalf of the CEO, Dr. French Sioi, and the Director of Health Product and Technologies, Dr. Hamed Mohamed, we are here to give or make a media briefing in regards to several issues that the Department of Inspectorate and Enforcement has been able to identify alongside our enforcement activities, and we found it good to inform the public so that the areas that requires their attentions, they can be able to act on them and also probably get information that may be lacking alongside their practice. For our purpose of this meeting, our colleagues also are out for activities in different areas of these several regions, reached from Western Nyanza, Northern South Rift, and we are here in Nakuru as a representative of the team to give a media briefing. In this, we are touching out issues related to the activities that has been ongoing for the last 3-4 weeks, and this is in regards to the wholesale audit, to audit the supply chain integrity alongside the supply system, and also we have been auditing private and public hospitals to check the compliance of good distribution practice and other relevant regulations alongside. And equally, we have also been trying to work out on the enforcement of the guidelines and rules for transporters and pharmaceutical waste and disposal. So in this, I'll touch in summarized manners that the issue that relates specifically for wholesale audit that we are touching, as we audit the supply chain integrity, we would want to mention that that's where the problem starts, because alongside the manufacturing to the distribution, we have identified that that's where the several issues are identifying that actually crop up to several malpractices because of lack of keenness of several of our distributors. So the wholesale outlets mainly have several areas of checks, because these are the people that highly have been identified by the stakeholders and even by the board as the source of distribution to unlicensed outlets. Whether wholesale is licensed to practice their wholesale dealers, they are supposed to purely do a right practice so that they don't make product or medicine accessible to any unregistered outlets. So we have been auditing this, and several wholesalers have been keenly seen that they are not able to comply with these rules. And of course, being the first point of distribution area, we have identified it as a high risk zone where illegal products are likely to be accessed by our public and any other retail premises that is distributing these medicines. So why did we purely focus on wholesale outlets rather than now going deep into our normal practice of setting out quacks? Is because again we realize that the wholesale outlets own high volume of products that are being distributed from the manufacturers or from the importers. These products basically lands to the distribution chain through their wholesale setup, and these wholesalers now are the people who distribute medicines to premises that are registered to practice retail practices. And in this case, you find that now alongside, some of them lax out the system and start now distributing these medicines to unregistered outlet. So our focus will be highly into these wholesalers who are distributing to retail outlets that are not registered or premises that are not registered. For that purpose, there is also some serious regulations that they are supposed to be enforced against them because of that kind of breakages. Remember also the issue of storage. Alongside that, if they do poor storages, they are likely to affect the medicines, and by the time they land to the patient, then the quality and the efficacy of those medicines may have actually gone into lower levels, and therefore the effect to heal several illnesses becomes an issue. Remember also alongside that issue of handling and all these kind of things, handling medicines, misuse of controlled medicines, disposal issues, all that kind of a thing now alongside, the volumes are quite huge in the wholesale setup. I also want to mention that these distributors have also their vans, the vessels that they use to transport medicines to these areas of consumption, to these the retail outlets or the distribution chain network. These vessels are supposed to be licensed as well. They are not supposed to transport within any vessel that is there. Most of them are using matatus. Most of them are using, other means of transport, lorries, which are not actually compliant as established in our guidelines for transporters of pharmaceutical product, and equally to the rules of transporters of pharmaceutical product. So all these vessels that they are using, they are supposed to license them so that they are actually regulated and we know what kind of vessels they are using to transport medicines to those other areas. So the other issue is that we have also identified alongside the wholesale setup that the personnel that are selling medicines or they are holding or they are taking care of the medicines along the wholesale setup are not people who are within our regulatory network. Either they are not registered as pharmacists or they are not enrolled in pharmaceutical technologies, and as soon as they acquire the license, their pharmacists picks off to other jobs and leave unqualified people. This is again an area where the integrity needs to be properly checked, and we establish that these medicines are properly distributed by a check of a qualified person. And I think that's where the network now breaks up, because these people who are not qualified, they don't bother who is this person they are selling medicine to. So for those people who have given licenses to those premises, they must ensure that their license is tied to their practice. You cannot issue a license and leave it to practice by itself. So if you have registered as a wholesale outlet, the consequences are huge as a pharmacist. Remember, you can be deregistered through the NDC system, and other sanctions also are there. You can be suspended. You can also be asked to pay some fines depending on the levels of your criminal obligations. So let them know that these licenses are supposed to be taken care of and also remove those type of risk. I also want to note that there are also people who have registered outlets of wholesale, and at some point they have decided to change their locations without informing the board, which is a very serious, oversight, because when you have registered your outlet, is supposed to stick to that premises that you originally registered, and if you feel like you want to vary it from that area, then you need to inform the board to inspect the other premises before you go there. So we have also been trying to check, and especially in Nairobi region, to check a few outlets that are there. You find that the pharmacies, they registered an outlet, and finally when you're looking for that outlet for inspection, they may have relocated without informing you. That is already an illegal outlet. So the license is tied to a plot number. So if you relocate, your license is ceased to now identify yourself with that premises. So as I also check on that, let me also note that we also have illegal wholesalers. And I think this is a very serious area that is now also giving us a very sensitive area of focus. There are those retailers, either in Nakuru or any other place in Kenya, who have been licensed to practice retail practices or to do a retail practice, but alongside the retail practice, they buy consignment from distributors that is huge, and now they start doing the wholesale practice. Those people should know that that's an illegal practice, and that's an area that now they are taking advantage of, and again start distributing to the Quacks or the outlets that are not registered because they are not in the network of wholesale regulatory system where we are able to identify that these medicines came from here and there. So purely let them know that that's an unlawful distribution practice, and therefore when they are identified, because those are actually our focus now, we will be able to prosecute them keenly and ensure that they actually face the legal processes for the mistake that they are making. So we also know that alongside the distribution chain, there's also likelihood to get unregistered medicines, because most of them are also doing importations. We are only asking them again to be very keen on the medicines that they are distributing, because you realize that the channels of the consignment that they are distributing is also likely to have traces or product that are not within our registration network. So let them be keen, because that's a very sensitive area. All the medicines that they are distributing must come from purely licensed importers, purely licensed manufacturers, so that they can avoid medicines that are not registered. In this, you need to note that for them to identify on these, then they must have all the full documentations of what they are supposed to distribute. There is no time that you can keep medicines on your wholesale setup without having the documentation to support your product that you are storing. So issues of buying product without knowing the source is already a rent zone area. On noting on this, of course, we again say that there is a need for batch tracing, because for them, they again distribute medicines without identifying the batch within their invoices. So when you are distributing medicines, identifying the batch within that product in your invoice is mandatory, so that when there are issues of complaint of that product in the market, when there are issues of any form of an issue that's purely raised by even a patient himself, then we are able to trace that specific batch and tell and advise as a board whether to recall or do any other necessary action that is required, so that the product does not easily access to injure our public. So noting on those few issues, I also want to note that there are undeclared warehouses. And this is also coming from outlets that are registered, and also unregistered outlets that are actually dealing with the network illegally. You find that a wholesale dealer is licensed to operate the wholesale practices. He declares one stores of his medicines, or one warehouse. Alongside this, he has several other stores that are declared in different sites. In these sites is where now they keep medicines that probably we could be looking for. And the declared store is now where we are. We have our own intelligence system, and we are working with other agencies now to unearth all this. And of course, it has been an issue. The DCI, the National Intelligence System, also is assisting us. So for them to keep those stores or warehouses and declare to the board, soon as we get to them, the board is going to revoke their licenses, and then we take up necessary actions. So it is up to the pharmacists in charge of those shops or those chemists to ensure that those stores that are undeclared have been declared and accordingly licensed for them to be inspected as other premises are inspected. So we need to work out on that and see that all those are actually kept well and inspected as required. It's also good to note that they are not supposed to incorporate in their form of business or any other form of subdivision of their outlets before the board inspect, because we realize that some of them would continue accommodating medicines for other companies, while the original shop that we inspected was only made for that specific space for that premises. So before you accommodate any other person, then it is also important that you bring in a version of ensuring that the board has inspected the premise and given you and go on that this premise can now, as a space that is enough to accommodate other companies, to probably as an agent or something like that. Also to note now, as probably my last part on this, is the issue of mixing up the retail outlet and the wholesale outlets. We find that most of the wholesalers within the same premises, they have also started now doing the practice of retail. That is not allowed by law. It's not allowed, and we are telling those people who are doing the same within the same premises to purely separate it within the shortest time. because we are not going, the practices compromises each other. We cannot just allow them to mix the businesses of wholesale and retail. But it's good that they get the information for those who does not know. But the essence is that, again, the obligations of reading the law, the obligations of reading the guidelines, the obligations of reading any form of a policy that exists within the Ministry of Health and Pharmacies and Poisons Board is their obligations. So let them know that retail and wholesale cannot operate within the same door. That's it, and I will request on issue of wholesale, before we go to the next area, I will request my colleague John Mwenami to make a point on our wholesale where I may have left it not working. John.
My name is Mwenami Kamau. I'm a Senior Regulatory Officer, Enforcement and Surveillance, Pharmacy and Poisons Board, Nairobi. I would wish to emphasize on the role of the wholesale dealers in pharmaceuticals, and they are the guardians for health products and technologies, because they are required to ensure that the storage and handling of health products and technologies adheres to the good distribution practices. So I would wish to call upon all registered pharmacists who are charged to oversee wholesale dealing in pharmaceuticals to ensure that they are complying with rules and guidelines for good distribution practices, especially in the area of batch tracing and route tracing, whereby they are able to account for all the pharmaceuticals they are handling, and also ensure that they are keeping a database of all the clients they are supplying to ensure that the medicines do not get into the hands of those people who are not qualified. Equally, I would like to call all those pharmacists who are responsible for managing wholesale dealers to ensure that they are present at the premises they have been licensed by the board to work at, in order to ensure that those premises are not run by unqualified personnel at any given time.
And therefore, I'll go to Auto Audit. In Auto Audit, we are now based to only checking level 4s. We have done several audits on level 6, A and B. We have also done a few of level 4s the last 1 week. We are planning again to do audit of level 5, which of course we didn't last, we normally do once or twice in a year. So this financial year we are on track with those levels. And I want to note that there's several requirements that does not separate the private and public hostels. One, I want to note that when I'm talking about level 3 to 6, I want to note that in audit we have a focus to check on our licenses. We have a focus to check on the personnel. We have a focus to check on the product, and equally to check on the operations. Now, those premises from level 3 to 6 are supposed to be licensed by Pharmacies and Poisons Board alongside other licenses from the Medical Council. The pharmacy department within those hostels must have our license. The pharmacy department along those hostels must have qualified personnel that are now licensed by Pharmacies and Poisons Board as well. Because we cannot say that a nurse can manage the pharmacy within that hostel. A lab technologist or a technician cannot manage that section. That section is purely managed by people who are legalized by Pharmacies and Poisons Board. So what are we trying to say? We are saying that those premises from level 3 to level 6, pharmacies within the hostel, they must have a Pharmacies and Poisons Board license. That is not negotiable. It's known by law, and we cannot oblige ourselves out from that. 2, they must have qualified personnel as per the MOH existing guidelines on staff establishments. That establishment is there, is purely there, and they need to check on it so that they can comply with it. All the way from even level 3 to 6, and they need to understand that our business is enforcement. Our business is purely enforcement, so if a law comes in, if a policy is there, if a guideline is there, and we have given the mandate to enforce, we will just enforce it. So for them, they need to comply on that. The other bit is that there are hostels also that are operating on 24 hours. We've realized that they operate within the 12 daylight hours with a qualified person. Alongside night, the premises of the pharmacy department is left to be operated by either our colleagues, the nurses, or probably the support staff who are working in the pharmacy department. So for them, when we are doing the auditing, they must show us proper duty schedules to show that the pharmacy is covered also on off hours and nights duties so that we don't leave medicines under the hands of unqualified people at that time. We again say most of the products, almost 80%, are also consumed by those hospitals, and also some restricted medicines are also within the same setup, and we are requesting that they ensure that these medicines are made by qualified people, because most of psychotropics, narcotics, and other medicines that are even used in theaters, and of course, extreme product that needs to be, even actually chemo and other anti-cancer products are also within those hospitals. You can imagine if those products are left under the hands of people who are unqualified. So we need to be very keen on that, and the hospitals need to check on that. Of course, we say that this is a high-risk area, because again, it exposes patients to several areas. If it's not properly manned, of course, issues of medicine errors and drug resistance issues. We have also issues related to drug abuse. We have, issues of disposal or deteriorations of medicines due to poor storage. All those type of things can come in alongside an hospital that is not properly manned. Along these, now I would say private hospitals have no obligation to comply while the public hospitals does not comply. The law is clear that any premises that stores medicines must be licensed by Pharmacy and Poisons Board. There is nowhere the law speaks that it must be either public or it must be a private hospital. So our message to the chief officers and the CECs and the governors is that please ensure that those premises are registered firstly. Any hospital from level 3 to level 6, alongside their setup. We understand, of course, the governors does not manage the level 6 hospitals. So we say from level 5, level 6 hospitals, surprisingly, the referrals hospitals, all of them are licensed by the board. But the level 4, 3, 5, you find that segmentally, some of them are licensed, others are not licensed. So whether they are public or private, they must be licensed. The only thing that we can only, because these are government hospitals, is probably to speak about a simple waiver for the public hospitals. But we cannot waive the practice. We can only waive the premise. And that has been happening for those that have come in. So the premise must be registered, and we are ready to waive, so they get the information that the board can only waive the premise fee, so that now at least we have them now are licensed. So when I touch on this, I also say that we have noticed along the private hospital audit activity that we've carried, several people who go seeking medicines there are not properly, they are not verified properly. So you find when we're even talking around with a professional who we think is a professional disappears because they are quacks. So most of the area that people forge documents to go seek jobs is in the private sector, specifically the hospitals. And this is not the first time that we have investigated a case of a person being employed in private hospital with the fake documents. So what are we trying to say is that when they are engaging these people, they should request the board to do proper verifications of their documentations. Because when you seek to employ a person without proper documentations, verification, then the problem starts like you are likely now to have employed a wrong person. So we request that the burden of verification stands with the directors of the hospital or the administrators, because otherwise we may assume that you are an accomplice, isn't it? We may actually assume that you are aware, but you wanted a person to come in and seek the job. The other bit for public hospitals is that also when the public service board, the county public service board, is also employing, needs also to verify with the Pharmacy and Poisons Board for the personnel they are engaging. For the last year we did some serious check, and we then ended up prosecuting around 3, 4, 5 people who were employed without proper documentations. So this message should actually go out clearly that verifications for private and public hospital is a mandatory requirement, so that we don't keep to engage people who are not qualified for this career. So with that, I would again request one of my colleagues, Dr. Gadogo, to come and make a point on touching the private hospital issues, and then we make a move.
I'm Dr. James Gadogo. I'm the Regional Regulatory Coordinator for Central Region, Pharmacy and Poisons Board. And talking about private hospitals, we need to appreciate that in a hospital setting, the pharmacy department is the last point of contact between the patient and the caregiver. So it's very important for the pharmacy department to be manned by qualified persons so that the patient can get value for their money and so that they get the right kind of attention. So what I would like to say is that our mandate is to ensure that we promote the profession of pharmacy and protect public health in terms of ensuring safe, quality, and efficacious drugs are given to patients, even in the private setting. And when you talk about regulating the pharmacy in the private outlets, the private hospitals, it's also good for them to note that they need to comply with the staffing norms, the Ministry of Health staffing norms, so that at any one point, whether it's daytime or nighttime, there is a qualified person attending to patients. It's also good for them to note that it's upon them to verify their suppliers, because again, that's why we were being told there are some suppliers who are not regulated that tend to be supplying or distributing drugs. So it's up to the private facilities to ensure that before they engage their suppliers, they ensure they are qualified. Another important thing is to ensure that this being an inspection of level 4 to level 5 hospitals, it's important for them to know that starting 2025, the new licensing year we are about to get into, they'll be required to have pharmacy licenses, and these licenses are supposed to be superintended by pharmacists only. So I think with that, I've summarized what is required for the private hospitals. Thank you.
Hostels are the most likely area of also receiving black market products that are either imported through our system because most of the hostels directors think that the inspectors are not able to come there. We are only concentrating on the parts. Again, the information that should go out is that they must ensure that the medicines that they are getting from suppliers are from the genuine supply chain systems, so that we don't have people coming with their bags to tell them, oh, those kind of things will bring a lot of problems. Again, in hostels, the government specifically, the government or the public hostels, when we are auditing also, we want to hear information if there's issues of government product being stolen. Because that's also our burden to ensure that those criminal network, we have also carved them off. So, of course, we may say that currently we have not heard of it, but let the county communicate to the board to specifically ensure that we have an information in the case of charge so that we can assist them investigate together with other tax agencies like DCI to investigate those kind of medicines. The other issue, of course, as I touched, is when I touch issues of forgery of documentations, is not only Pharmacies and Poisons Board personnel. This also comes to other personnel who are working the board. And I think we are not only mentioning it as a bond, we also need to mention it for other boards. Because we have also realized nurses who are employed there. Because if you can get a farm tech or a pharmacist having been employed in the system or engaged in the system without qualification, it also tells you that a nurse can be employed. It also tells you that a clinician can be employed. And it's not historical because for the years we have practiced, we have even seen medical officers having been arrested in hospitals who are not qualified, isn't it? So we need to be very careful, not only for pharmacy. Also, other councils should probably support up the board, and we probably go for a joint check in this system to see whether the people who are employed there are qualified. I'll check on the issues of disposal, and when I talk about the disposal, we have an existing rules, and we also have the issues of, we have a guideline that we enforce. So we have also law, 244 laws of Kenya that we enforce in regards to disposal of pharmaceutical waste. These pharmaceutical waste are either expired medicines or these are damaged products that may have gotten damaged alongside the distribution chain. probably zimenyeshewa, zimeanguka, zikaharibika, all that kind of thing. So we don't only dispose products that are expired. So don't look at the disposal as only expired product. And again, you know, disposing expired product in a right way is a good practice, because automatically drugs will expire, isn't it? Drugs will expire, but the only thing now, a question that we'll ask ourselves, how do we dispose them without injuring public health? One thing I want you to note is that drugs can only be disposed by Pharmacy and Poisons Board. That message must go out clearly. There is no taxed public health person or no hospital who can wake up tomorrow and start dispensing medicines. Those are special commodities. Medicines cannot be disposed by any other person. The guideline for disposal, the MOH guidelines for disposal of pharmaceutical waste can only be done by Pharmacy and Poisons Board. This can only be done under supervision of a drug inspector. And after disposal, the certificate of disposal is issued. So let's not confuse the disposal system of pharmaceuticals. It's only supposed to be done by Pharmacy and Poisons Board under supervision of a drug inspector. And we are not deficient of inspectors. They are all over in the country. We have offices in all regions. So any person who wishes to dispose his or her medicines from their facilities must always get in touch with, because in 1 or 2 years, you must give us evidence on how you dispose to your medicines. And remember, the law is there, you can easily be prosecuted. 2, you're not supposed to keep your expired consignment within your quarantine area for more than 1 year. And this does not only appear for the public or private hospital alone, it's for all. So we are not specific. So the governors, the county system that are keeping medicines for years, let them know also these are legal structures that can easily come back to them. It's not an easy system to keep expired or damaged medicine, because they can easily come back to the market. And our protection is to ensure that they're disposed within the shortest time, so that we don't have issues of those medicines coming back. The issue, of course, of handling those expired medicine is also an issue in us, that these medicines, that they are expired or they are ready or almost expiring, they're supposed to be removed from the shelves to put into the quarantine area and list taken for readiness of verifications and disposal. These disposals are also, because most of them are just burning them anywhere, they are supposed to be done under a NEMA accredited disposal site. You cannot just pick medicines and go burn them with the PGH. If that area, or if that coit incinerator or wherever is, call them, is it incinerators? If they are there and they're not accredited by NEMA, then we cannot dispose medicine there. So they must actually know all these kind of levels of procedures. And the problem of disposal is not only for private, it's for public. If you pop in to any county, for example, here we are in Nakuru, I would always find a consignment in a certain hospital that has been lying there for quite some years. Reasons, I don't know. So it's also an information that needs to go out, that any medicines that may have stayed alongside their stores or in their quarantine area for more than 1 year needs to be removed, because it is also endangering them legally. So one thing also I need to work out is that, or to tell you, is that there is a need to segregate the practice of handling those products. One, you cannot just pick the product from the premises to the disposal site alone. It's supposed to be taken there under supervision and under a designated vehicle. Huwezi weka kwa lori tu anze kupeleka ndawa kutoka hapa town mpaka kwa disposal site. An inspector must come and lock the linear and put a seal, and then so that the product does not get stolen along the route. So the guideline is very clear. So what I'm trying to say, kindly guide those people to read the rules, the law, the guidelines, and the policies that are existing that touches the disposal. Before that, I also touch on the issues of transporters of vessels. Again, we have rules, we have the law that exists, and we have also guidelines that touch clearly on transporters of pharmaceuticals product. pharmaceutical products are not just carried like any other products. These vessels that are transporting this pharmaceutical waste or this pharmaceutical product are supposed to be licensed by Pharmacies and Poisons Board to check whether they comply with the cold chain system and any other requirement that we are supposed to check. Because, for example, you may want to move products from here to Turkana. You cannot just put in an open consignment because the temperatures are all over getting hotter as you move. By the time the product arrives in Turkana, they are already damaged, isn't it? But you realize now they continue consuming without knowing. And these transporters licenses are not only for people who are practicing pharmacy business. These are also for people who are purely transporting. For example, I'll pick the G4S, the Wells Fargo. I'll pick even the buses that are moving from the Tanzania, Uganda, and any other countries, bringing medicines around. In reality, is that these vessels are supposed to be registered. So there is no company that is transporting medicines, whether it's even a monoline, that is not registered. Because if we intercept that Nissan alongside, the Nissan becomes an exhibit. Yes, it becomes an exhibit because how else am I going to prove that they were being transported? So anybody who is transporting medicines with any form of a vessel, those vessels must be licensed. This is an obligation of two people. It's an obligation of the owner of the product, it's an obligation of the transporter. The owner of the product first must verify whether the vessel you want to use is licensed. The owner of the vessel must also ensure his vessel is licensed. So it's an obligation of two people. All this having been said, therefore, for those people who are holding up vessels that are not registered or that are not licensed, please let them do that within the shortest time. Our next work plan, or the next activity, of course, that we have been doing, but are joint now because routinely we have been arresting all of them. Routinely, we have been doing it. But our next joint is to intercept all those kind of vessels because the law is there to implement and enforce. So let them know that because we don't want a scenario where people are saying we did not know. The law is clear and it's again their obligation to read the law.
Moinami Kamau, I'm a Senior Regulatory Officer, Enforcement and Surveillance, Pharmacy and Poisons Board, Nairobi. The guidelines and rules for transportation of pharmaceuticals places an obligation for any person engaged with the transportation of pharmaceuticals to ensure that they are complying with the requirements for good distribution practices. The integrity of health products and technologies can only be enhanced and maintained when we observe good practices in terms of transportation. And these rules requires that transportation of pharmaceuticals in Kenya should be under the supervision of a registered pharmacist or an enrolled pharmaceutical technologist. Equally, these rules applies to everybody engaged with the transportation of pharmaceuticals from the manufacturer to the end user. And this also covers people who are not actually pharmaceutical practitioners, people engaged in courier services, transportation of parcels, and they carry pharmaceuticals. They are required to comply with these rules. These rules came to force in the year 2019, and we would wish to call upon everybody engaged in the transportation of pharmaceuticals to ensure that they are complying with these rules. Because the board have started enforcement of these rules, people should ensure that they are fully compliant. Thank you.
Professionals that the renewal of licenses start on 1st next month for 2025 so that we can close up the gap for illegalities from January. So we request that there would be no resource from capping up for not registering that the licenses needs to start, people need to start their renewals before so that we have a peaceful practice obligations. Then also the issue of quacks, we need to mention they shall always exist on their risk. It's a risk area for them. Let them exist knowing that when they are caught, life will follow due process because these quacks, whether they source their medicines through any other way, but let them know that it's a wrong thing that they are doing. For our colleagues, we will not hesitate to enroll them for EDC, for those that are violating, because it's our obligations as pharmacists and pharmaceutical technologists to ensure that we do the right thing. So again, let's not remind them what they're supposed to do, because these are career-based issues and these are sensitive career that people need to have an obligation on. On behalf of the CEO again and the director, health product and technologies, as the end of enforcement and surveillance, those are the few ones that we were to give on their behalf. Basically, let me just note that arresting during the audit of hostels and hospital audits and private hostels does not just occur like the way we arrest the quacks. It's not like a run up, arrest, take to court. We prepare the files. Already there are around 15 files that we are preparing. It's just like the way you realize that other agencies are preparing the file, because they are not running away. There's no hostel that is being closed tomorrow, isn't it? If you find an obligation that there is a gap within an hostel, you take time to investigate and prepare the files slowly by slowly. Currently, as we are talking, we are preparing files. We are preparing files for a few people who got out of network, and we are going to present them to the ODPP. And that one is a fact that we will do a follow-up on you, because we want also them to be big fish that are going to set an example in the market. So soon as we are done with the files, we'll present them for verification by the ODPP, and then the files will go to court. So it's not an emergency that you go and arrest these people like that. Because today, for example, if I pop in, which store is in Nakuru? The level 5? PGH. If I go to PGH, I don't have to arrest the person there instantly. I can start preparing the file within a week or two and just pick out and say that this is done. So we will give the information through our PR as time goes on. When a file is at the investigations, let me speak out frankly, because these are things that we know, all of us. When a file is at the investigations, a lot of things goes on around it. So allow us not to mention that, but let me say that it touches the practice, the hostel itself, and also there are those that touches the professionals. Why am I saying this? For example, a professional may have given a license to an hostel and disappeared off to leave the license to practice under no supervision. That is already an obligation that goes to the personnel. An hostel may be existing without even a license. Who is again obliged to this is an hostel. So we will stand on that, and again, you allow us hold that, because when something is under investigations, we'll have to give you an information when it is out. For prices, we don't regulate. These are liberal markets. Actually, you can even give your rice for free. If you feel like you want to give for free, I think that's not the obligation of the board. Ours is purely regulatory on practice issues and all these kind of things. But for public, I think there are several things that they need to check out. Of course, the information is, again, even for our people. For our people, we know the quacks, isn't it? That's not a secret. Even you go to Kaptembo and find our premises, you can see, like yesterday I was talking with one of the DCs and he was telling me, kuna tunduka tumekuja hapa. Hata ukiangalia tunduka is now, you also find that this is a problem. This is already a problem. This cannot be a pharmacy. The only thing you need to do, they don't report. Our people, they don't report. For example, when you tell people, please give us information on those suspected illegal outlets, they just come up with them. I don't know why. We have an office here in Nakuru, but really, the officers here in Nakuru get an information, even from Kaptembo or any other place. We don't get information from the public. Not because that they don't have an information. Again, these are people that they live with within those estates. And you know clearly that this person is not qualified. It is the one who is administering even an injection to you. So the public has a big obligation, let me say that, because their business is to report to the agencies. We need to cultivate those kind of traditions to also give out information to the agencies that are protecting them. Okay? Two, when you go to an hostel, there is always a license that must be properly displayed. A license must be seen there, and that license bears the name of the person. That license bears even the photo of the person who is serving you. So all that kind of a thing, you need to check and even see whether the person who is serving me is really the person who is in the license. Because it could be you, a lady. And I always say that then the photo is for a man. I don't know at what time did you dress again to be a man when you are a lady. So I think all these things the board has done is part. The biggest part also remains to the public, and the public must be aggressive in verifying. Because again, medicines are very sensitive commodities. Soon you get into bad drugs, you're already on it. So our obligations is really a huge one, But we need to be supported by the media, we need to be supported by the public and all these people through an information sharing system. Yes.
So how regular do you do the crackdown?
Frequent, and that's why actually, not even track down, that's why we have several, I wouldn't want to go to those deeper bit, because we have several forms of inspections. Like for the routine inspections, we have an office here that does routinely inspections. Remember, arresting a quack, and I want to tell you the truth, is not easy. Because when I move from the office here and they find our vehicles, they have a network of WhatsApp, they have a network of mobile talking and all this side of it. I may learn to one quack, the rest they communicate to Amefika Kaptembo. You get. So we also have hold hours. The numbers is also a problem. Like in Nakuru here, we have around 3 staff for thereof. You cannot tell them they are taking care of 5 counties. So the government also should support in employing more, but we are not crying. But we need to support more so that we can at least have inspectors all over, so that we can cover issues. You can imagine the inspector who is supposed to be here is the one who is supposed to check what is happening in Narok. The inspector who is here is the one who is supposed to check what is happening in Samburu. The inspector who is here is the one who is supposed to check what is happening in Nachas Post. The inspector who is here is the one who is supposed to check on what is happening in Kericho at Bomet, how practical it is. So we are only saying, if we get the numbers, then there is no problem. But as the numbers that we have today, we are trying to do our best. We are trying to do, like when you sit here, you realize we have released all our inspectors here. We had a meeting yesterday. There are people who have gone to Western, there are people who have gone to Nyanza, there are people who have gone to North Rift, and there are people who are here. So we have tried to minimize even the presence of the media so that people can be at the ground. So it's our obligation, and we accept it. And we are doing it to our best. Unfortunately, the risk is spread for either people qualified, unqualified running the stores, people and distribution. But of course, when you check on the distribution, say like wholesale issues, most of the wholesale outlets are segmented within the Nairobi city. And of course, again, the population risk is high, isn't it? So Nairobi alone has over 500 to 600 wholesale outlets. If I come to Nakuru, there are not even 20. So the risk, of course, lies there. For the Osto, there are far-reach areas like Mandera, like Wajir, like Moyale, those Turkana. Those people, of course, due to vast areas and other factors of their environment, they are likely to, to legs up the law and do things that are not like to be. So in monitoring system, you find that those people who are closer to the law, let me call it closer to the law, as much as the law is for the whole country, there is also people who are actually closer to others, that way I can always pop in. But again, you see the population, like for Nairobi, if I segment and say I want to do, only thing one wholesale or even one hostel takes almost a whole day. It's not like running against a quack. Like for example, if somebody enters PGH there, you will come at 5. Because you have to audit, pure audit. It's a lot of work. It's a lot of work. That's why even you cannot make a decision whether you want to arrest immediately. Because there's a lot that you need to check alongside and see whether the levels of compliance are either 50%, the levels of compliance are either 20%, those kind of levels. But the risk is spread in those vast areas and also the high populated areas. When you break the law, you break the law. Let me say that, because there's no time to continue giving you time to break the law. If the law is broken, it's broken, and we have to give them sanctions. We have to give them sanctions as outlined in the ADC, or probably as outlined by the law, because most of them know that they don't know. Because, for example, if you are found with unregistered premises, what made you not register? You can register even tomorrow. But of course, if you comply before your file is ready, of course you committed a crime then. You committed a crime then. But as a compliance pardon, people may sit and say, a warning letter so that you can comply every time. But issues of unqualified person handling medicines to the public, how would you even want the person? How do you even give the person the notice that tomorrow please employ a person and you have not closed the hospital? So what we have done, we have closed it. We close the pharmacy first as we investigate. So you close the pharmacy and move on. Hospitals are less than the people who exist as professionals. They are less. You remember, for us to register a hospital, the first requirement is one, the major requirement. The hospital must be licensed by the medical board. That's a requirement. That's a major requirement. If the medical board, we cannot license a pharmacy within an hospital that is not licensed by the medical board. Okay? So as soon as the medical board licenses the hospital, then it's our obligation now for the hospital to do an engagement of a qualified person who is a pharmacist or a pharm tech to now come in and be part of an employee now to take care of the pharmacy department. Okay? So the first requirement, the license you need to attach in your application for us to issue with a license is a license from the medical board. So that's where the major verifications are done, uko medical board. Then now for us, we only need a license to know that this hospital is known by. In fact, the list that we are doing for the audit, the list for the audit that we first check is the list from the medical board. We ask them give us the list of the hospitals that we've licensed so that now we can audit them. So we cannot audit hospitals that are not within their network unless if the hospital is not registered. And when the hospital is not registered, it's not our obligation. Our obligation will only check the chemist inside it. The other obligations go to the medical board. You get what we're trying to say? So ombuds and councils, the Ministry of Health have their own roles and obligations and responsibilities. I don't know whether I've answered your question. Because for us to check in about the pharmacy department, we need our personnel and our license. And then we check the medicines. You see, our interest is where medicine is. When you're doing this report, check our interest is where medicine is. Even if today as a media team you tell me there's a house that is storing medicines within Bodoni, in Nakuru, I'll wake up very fast. It doesn't need to be an hospital. My agitations is medicines. Medicines as a Pharmacies and Pharmacies board is medicines. So if the hospital does not stock medicines, I have no business to go there. If they decide they don't want to keep a pharmacy inside there, what are we going to inspect there? I don't need to inspect any other department. Unless if you are doing an holistic kind of a joint audit with other boards and councils. But for now, as a Pharmacies and Pharmacies board, particularly I will focus where the medicines are. And that's what tells me now who is managing these medicines, whether the premise is registered and all these kind of things. A pre-registration inspection is the initial inspection that establishes a premise to exist. In that case, there are several requirements for that premises to be approved. There is a layout part of it, the size of the premises. So what I was saying, if we approve the original size, for example, which is this premise down here? Care Pharmacy. If we approve that size of that premises originally to now fit for the pharmacy, the minimum requirement, it cannot introduce any other business in it. Unless the board comes in again according to our guidelines, if they feel like we want to introduce an M-Pesa or any other shop within that segmented size to see whether this other business is not coming to interfere with the original size that requires the minimum existence of this shop. You get what I'm trying to say now? So you cannot introduce another business in a pharmacy before the board satisfies that it's okay. As much as we remove that small size, it does not affect our minimum requirements. You get? So those are the basics. We can, yes, agree, introduce an M-Pesa, but we must have expected the premise to see that it did not affect the very original layout, the very original size of that premises.
What happened to the size? Because normally when you introduce something else, the size becomes smaller.
Yes.
Does it mean that the size is being altered, or
you alter the size?
you look for the safety of the space?
It's a size. The size of the premises matters a lot in a chemist.
Does it become smaller, or what?
It becomes smaller if you introduce another business. Because of course the other business will require space, isn't it? Isn't it? When you introduce another business, the size is interfered with.
Yeah.
So that means the size that was there has already been reduced. And now probably it goes below the minimum size that is required for an establishment of a retail shop. I don't know whether we are together. Please ask for clarification. No, what I'm saying, you can even ask me after this, but I'm only saying the size that is required must have a minimum for a certain practice. Say if it's a retail or it's a wholesale. The guideline is very clear. But now, you could be having a whole of this size that is beyond our even minimum required size. So you may want to introduce another business within that other business that can conform. Of course, huwezi kuja kuuza manguo ndani, say an M-Pesa or something like that. So when you come, we must evaluate the size that you are removing for the M-Pesa does not interfere with our minimum requirement for the retail shop. That's what I'm trying to say. You are telling me to comment about the threat that we face. The threats are huge. Of course, you know, this is a high-risk job. It's not an easy job. And we don't say that we have not experienced those type of things. One is that when you close somebody's hostel, it's not easy. You know, it's not easy. When I come and close your hostel that is worth millions of money, how do you feel? Enforcement in this country is a risky job, and nobody who loves enforcers, I can tell you the truth. Even the police know that they are very bad, but people fight them because they are only looking for the bad part. Even for you, when they pop in and start throwing your cameras here, you'll always get to. So for us, we are only empowered by trying to support the public and protecting them. There's a lot that we do that is not seen to support the public health. Because you can imagine, a scenario where there is no inspector, the airport is not taken care. She's in charge of ICD, the import center, where all medicines that are coming to Kenya through the sea. She's the one who clears them. Now you can imagine if she does not clear them, everything comes in. We have people at the port of entries in Amanga and all over who are intercepting those vehicles every day, not to bring drugs from other countries. We are also within the setup of the good distribution chain to check that all these people, Quacks, who are existing or not. So those are threats. Sometimes hata wanapanganga watu wa pikipiki wanatupika tukiwa kazi, lakini tumezoea. Saa zingine tunatusiwa kwa social media, hata zaidi tunatusiwa tukimalizana na hii. And we have no problem with that. And of course, if we silent, because that's what we have been employed to do, isn't it? We have been employed to protect public health through ensuring the drugs that we are taking are of safe, quality and efficacious. Sasa tusipoambia nyinyi, kwa sababu tunaogopa kutusiwa kwa media, tutafanya namna gani? Si lazima tutaendelea na hii maneno. Lazima tushike hospitali kesho, lazima tufukuse Quacks, lazima tu ensure zile dawa zinakuja, they are protected. We must also ensure that all people who are working there are qualified. Sometimes even we wrap up with our colleagues who are also practicing. For example, if I take a colleague to the NDC, kama huyu sasa nitakuta saa hii nikute barua yake iko hapa lakini yeye yuko, si lazima nitamungisha kwa disciplinary. Do you think we walk a journey together? It's not easy. So we pray God every time to protect us also as well. But issues of corruption, me I will not mention it because those issues, we are not the agencies that of course, you know, Kenya has its own issues. But issues of corruption, the team, I can tell you, is lean. But people, of course, when you are investigating a file and you find there is no mistake, somebody will say that you've been compromised. That's what the public. You know, we are growing in terms of democracy. We are growing, and we have no choice. So people may say that yes, you have been compromised, but at some point deep into your heart, you know yourself, isn't it? All these kind of bits. Remember, also we are Christians. We are not people who does not go to church. So we are also Christian and strong Christians. So you also have spiritual ties. Our business is to protect the public, and simple as that. And we will do it. That's why we don't fear telling the media what we want to say, because this is a very sensitive issue about the public health. We have over 20,000 pharmacists and pharmaceutical technologists. They are off on average. So we are able to supplement the market. The market does not have those premises. The only thing that utaangalia vizuri ni ujue kuna wale wako kwa serikali hawapaswi kupractice huku na license zao, na kuna wale wameenda bando kwa community farmers na wako kwa kazi. So hapo kuna gap. Na gap ile iko ni wale wako kwa serikali, the obligations to ensure that their licenses are within those hostels is by their county respective county governments. Sisi tumewasukuma na tumeandika barua mara mingi kwa Council of Governors kuambia let the license be within the area of practice. So hiyo ni area moja ambaye sisi ukishaambia serikali nyingine ifanye kazi, unangoja ifanye nini? Ifanye kazi. But we are over 20,000. We have around 14,000 pharmaceutical technologists and around 5,000 thereof 6,000 pharmacists in the country. And there are several institutions, over 20 something, that are also training pharmacists and pharmaceutical technologists within the country. And every year we are graduating quite a huge number. So the numbers of institutions that are training have also been increased to cover the gap that is there by the board. So we have over 25 that are training those pharmacists and pharmtechs. And we have also increased the number and the capacity of training. So in the next few years, we could be over that because of the numbers that are being trained. long time, pharmacists were only trained in the University of Nairobi, only. And diploma holders were being trained in Kenya Medical Training College, Nairobi specifically, as a branch. These days they have spread all over. So no worry, the gap is going to be covered. The issue of generic medicines, we have explained several times. Generics are not counterfeit. Generics are medicines that are good and of quality. Generics pass through vigorous check like any other medicine. For example, I'll give you an example of how many amoxicillin capsules do you know in this market. We have over 300 in the market. Each, you come with your brand, we check whether it is properly manufactured, because we have also a department for manufacturing. They do their due diligence. Then we register your medicines. You register your own brand. You register your own, all of them have different names. That's why you call them generics. You call yours, what's your name? Omungacillin. Omungacillin is a say amoxicillin, nuance of amoxicillin. So you give your own, he gives this. There is nobody who is not going to be given every pharmacist has an obligation to bring his medicines. But your own brand, I can bring a brand of something, brand of something, brand of the same molecule. And that's the only way, by the way, we can now regulate the prices. Because if you have the autonomy of pricing, the board, because they don't regulate the prices, we also now bring more so that people can stabilize as they go down.